Chapter 1. After failing the interview, I was carried back to the hospital. You are listening at novelfull.audio. Linhai City, Orthopedic Hospital. Still not working? Su Chiu asked with a dim look in his eyes. Directly opposite him, several examiners looked at each other. After a while, the examiner shook his head and said apologetically. Although your interview performance was excellent, both your academic qualifications and the school you graduated from are a bit too ordinary. We have thought about it for a long time and think you can find a place that is more suitable for you than our hospital. Hearing the interviewer's straightforward rejection, Su Chiu did not hesitate anymore. After thanking the examiners, she left the hospital. He wasted no time. After failing to interview the third hospital, I rushed to the last hospital without stopping. At the same time, it is also the best and oldest hospital among these hospitals. Thinking of this, Su Chiu's expression was a little complicated. Even these inferior hospitals are unwilling to hire him, let alone the best Linhai No. 1 hospital. Sitting in the taxi, Su Chiu looked at the passing scenery outside the window and sighed softly. No one knows that he does not belong to this world. His identity is a time traveler. And today is the third day since he traveled through time. In his previous life, he was a master of surgery and opened up a large number of surgical restricted areas on his own. He is revered as a national doctor and medical sage, but now, he has traveled through time to be an ordinary little doctor. The academic qualifications are only a bachelor's degree, and it is just an ordinary medical school. With such a resume, it is a bit of a dream to stay in the metropolis of Linhai, no matter how good your interview performance is, you still can't save a bad resume. Su Chiu was a little helpless. His performance was impeccable, so that these three hospitals have hesitated for a long time. If it were anyone else who dared to bring such a resume, he would not survive the second minute of the interview. This is the last one, let's try again. After getting off the taxi, Su Chiu looked at the spectacular Linhai No. 1 hospital in front of him and felt powerless in his heart. It doesn't work in small hospitals, but in big hospitals. Alas! But, what if, perhaps, larger hospitals pay more attention to interview performance? Su Chiu can only give it a try. After all, the rent is due in 2 days. If he can no longer find a job or prove his source of income, he will have no choice but to leave the big city and return to his hometown to work as a doctor. Hope everything goes well. Su Chiu adjusted her mood and rushed to the interview location mentioned in the text message. 2 hours later, Su Chiu walked out of Linhai No. 1 hospital with a sad face. Sure enough, he was still kicked down. He did a great job in the interview. The interviewer even tested some of his clinical skills. Without exception, all scores are perfect. Even the main interviewer was full of praise. But, competing with him, he is a doctor of medicine who returned from a prestigious overseas university. He is a scientific research master from a top prestigious school and has several SCI second level or lower papers. He has an undergraduate resume. It's like a husky blending into a pack of wolves. In the end, I could only regret being eliminated. Su Chiu smiled bitterly and shook his head. The only thing to blame is that my previous resume was really bad. He stopped at the entrance of the hospital and took one last look at Linhai No. 1 hospital. After a few seconds, he walked towards the bus stop with an expressionless face. At this moment, a sharp pain suddenly came from Su Chiu's lower abdomen. Cold sweat spread all over the body instantly. Su Chiu slowly bent down, and the severe pain made him curl up on the ground like a crayfish. Still, he made a judgment instinctively. Pain that is enough to make you faint. My head is hot and swollen. Strong feeling of nausea and vomiting. The pain is concentrated in the lower abdomen, especially McBurney's point. Acute appendicitis. This symptom is so typical. For experienced doctors, the disease is a matter of seconds. If it were normal times, Su Chiu would be very happy to meet this kind of patient. But now, it's him who's sick. At this thought, a series of treatment measures quickly flashed through Su Chiu's mind, but soon, his consciousness was driven away by the pain. In a daze, the surrounding crowd quickly gathered around. Quick, someone fainted. Take him to the hospital quickly. This handsome guy is so lucky. He passed out right next to the hospital. Please help him. In a daze, Su Chiu seemed to hear someone saying that he was handsome. Then, his body was moved. When I woke up again, it was already an hour later. Woke up? The doctor in charge smiled inexplicably. Su Chiu looked. It was he. Hi, one of the examiners and deputy director of the emergency department. He put his hands behind his back and joked, unexpectedly, you still entered our hospital, it's just that he came in lying down. Su Chio's face turned pale and she had no energy to joke anymore. Then he asked, acute appendicitis? Yes, confirmed. He asked the nurse to bring some inspection reports. Blood routine showed an increase in Su Chio's white blood cell count. Point of care ultrasound, it shows a hypoechoic tubular structure, stiff texture, and a concentric target-like development in the cross-section, with a diameter of about 9 mm. This is a typical sign of acute appendiceal congestion and edema. Sign and prepare for surgery. After saying this, his eyes flickered several times, and he whispered, I really like you, kid, but it's a pity that you. Alas, I can't keep you, but I can leave an appendix as a thought. Su Chio smiled and signed silently. Next, it was preoperative preparation, fasting until the next morning. During this period, intravenous infusion of water, electrolytes and calories was given. By the way, preoperative examinations such as urine routine, for coagulation tests, for infection tests, liver function, etc. were completed. At 9 o'clock in the morning, the operation officially began. It is basically impossible to use doctors above the attending physician for a minor operation, such as appendicitis. Therefore, the surgeon who performed the operation on Su Chio this time was a junior attending physician. The other party was tall and thin, with 2 dark circles under his eyes. Su Chio was pushed into the operating room, and he came late after the anesthesia was given. Sorry, I just finished the operation with the director, cutting this appendix, right? Attending physician Wang Fan yawned loudly, changed into surgical clothes and came to the front of the stage. Soon, the operation began. Because it was local anesthesia, during the operation, Su Chio could stretch his neck and witness the process of his stomach being cut open. However, the more he watched, the more headache he had. The choice of the incision was not careful enough. If it is cut like this, it will injure many capillaries and cause heavy bleeding. Moreover, it will not follow the skin folds, and it will leave a big scar after the operation. Considering the integrity of his abdominal muscles, Su Chio couldn't help but ask, Doctor, can you fine-tune the incision? As soon as the voice fell, Su Chio's pupils suddenly dilated. The most terrible thing happened. Chapter 2. No one is doing the surgery. I do it myself. You are listening at novelfull.audio. With a heavy breath, Wang Fan, who was holding the knife, suddenly trembled. Then, his whole body seemed to have lost all strength, and he fell to the ground with dark eyes. The operating room suddenly became chaotic. Several assistants were at a loss. Those who perform appendicitis surgeries are basically interns who come to see the world. The chief surgeon is the general. If the general falls, how can the people below not be in chaos? At this time, the experienced equipment nurse stood up and shouted, Hurry up, call the nurse. As soon as she finished speaking, an intern hurried out of the operating room. At the same time, Yasuki squatted down and began to check Wang Fan's carotid artery pulse, breathing, etc. There are still pulses and breathing. Is it hypoglycemia? The intern said with some uncertainty. Seeing this, several interns nearby also squatted down and stretched out their hands to help Wang Fan up. The equipment nurse was furious when she saw this scene. Principle of sterility. Instrumental nurses hate that iron cannot become steel. In the operating room, the hands of medical staff cannot be lower than the operating table. It's good now, everyone is squatting down. Get out, everyone. Go back and wash your hands again. The instrument nurse was furious. The interns were so scolded that they all ran out with their necks shrunk. Pull Wang Fan out. Why are you lying here? The equipment nurse reminded. As soon as he finished speaking, several of the interns immediately turned back and carried Wang Fan out of the operating room. After this farce, the originally noisy operating room suddenly became quiet. Su Chio on the stage looked confused. I'm done with anesthesia now and am waiting for surgery. As a result, the doctor collapsed. Everyone is gone. The process of brushing hands and changing surgical gowns takes at least half an hour. Don't I have to get anesthesia again? Notice the change in Su Chio's expression. The instrument nurse came over and said apologetically, I'm sorry, our surgeon is overworked. Don't worry, we will soon switch to a more professional doctor to perform the surgery on you. Su Qiusheng lay on the stage helplessly and said silently, "I am also a doctor." Her words were enough to deceive patients. What about changing to a more professional doctor? In fact, I just found another unlucky resident doctor, and the quality may not be as good as this. Damn it, I knew I should have been under general anesthesia. The equipment nurse said from behind Su Qiu. He sighed, now there is no other option but to wait and suffer one more anesthesia in vain. Just when Su Qiu closed his eyes to rest, an interface suddenly appeared in front of his eyes. Big medical system, experience value, 0 out of 100. Ability, none, daily check-in, not in progress, task list, tasks to be collected *1. Seeing this interface, Su Qiu suddenly became energetic. Standard equipment for time travelers, handsome and golden-fingered. The previous one already exists, will the golden finger be coming soon? He quickly studied the use of this thing. The great medical system, as the name suggests, is a system for improving medical skills. Every day, the host can check into the system. The richness of the sign-in reward is determined by the influencing factors of the sign-in location. To put it simply, the more patients who are cured by Su Qiu at the sign-in location and the wider the reputation, the higher the impact factor and the rarer the rewards you get for signing in. In addition to daily check-ins, there are two other ways to earn rewards. First, perform medical-related actions, such as outpatient clinics, surgeries, etc., to accumulate experience points. When the points are full, you can perform an additional lottery draw. Second, randomly trigger system tasks. After completing the tasks, you will receive generous rewards. At this moment, Su Qiu's doctor system happened to have an unclaimed novice mission. Su Qiu completed the sign-in first. Ding! The impact factor of the check-in location is 0, and there is no bonus for the reward. Get a random reward, Master Purse Suture Technique, Beginner, Master, Expert, Master, Perfect, Masterful Purse Suture, 1 step away from perfection. As the system's sound ends, a large amount of information was immediately poured into Su Qiu's mind: purse bag suture needle insertion method, stitch length and margin control, stump burying and tension-free knotting, etc. As these memories merge, the next moment, Su Qiu's finger muscles trembled, and the mechanical memory of adapting to the master purse suture technique was engraved on it. After regaining consciousness, Su Qiu was pleasantly surprised. Just the most basic reward has allowed him to master the ability that a person who has been immersed in suturing for decades can have. So, what happens when the impact factor becomes higher? Moreover, it seems that the system still has a newbie task that has not been collected. Su Qiu quickly received it. Ding! Congratulations on receiving the novice mission. Task requirement: perform the appendicectomy surgery on the host itself. Task reward: novice gift pack *1. Master level appendicectomy *1. Su Qiu was speechless. It is indeed a great medical system. The novice's task is to cut out his own appendix. However, the rewards are also extremely rich. After tasting the sweetness of master purse stitching, this master-level appendicectomy surgery is so fascinating. After receiving the task, Su Qiu looked at the equipment nurse not far away. At this moment, she was extremely anxious. The circulating nurse sent a message saying, "Just a few minutes ago, a major car accident occurred on the Dongxing Road section not far away. The doctors in the emergency department, not to mention the residents and attending doctors who can perform surgery, even the interns, all ran to deal with the injured in the car accident. What should I do? The operating rooms in the general surgery and colon surgery departments are also full, and there are no doctors." Nurse Lu Susu stamped her feet anxiously. The anesthetic was injected and the knife cut a little. Should the operation be terminated now? Seeing this scene, Su Qiu's face showed a relaxed expression. The opportunity is here. He supported his arm and said, "If no one is doing the operation, I will do it myself." Lu Susu turned around and wanted to curse, but when she saw Su Qiu's face, her tone was still a little gentle, saying, "How can this be done? Don't make trouble. Wait for me to ask the superior doctor." Su Qiu didn't say anything. He glanced to the side and noticed the instrument cart left next to the table. Without hesitation, he straightened up and quickly squeezed some disinfectant. he then used an iodine cotton ball to disinfect his hands before the operation. Under Lu Susu's horrified eyes, he skillfully put on gloves, then, he held the scalpel. At this moment, Su Chio's eyes changed, sharp, cold, and sharp. Such a familiar feeling. Su Chio took a deep breath. He had held the scalpel for his whole life, and now he picked it up again, which gave him the illusion of returning to his peak. However, the unfamiliarity of muscles and hand feeling were clearly present. This body lacked the experience of thousands of trials and tribulations of surgery, and had not established the inertia of mechanical movements, so it was naturally much worse. However, it was more than enough to deal with a small appendicitis operation. Su Chio glanced at his lower abdomen. When he saw the condition of his abdomen, his face suddenly fell. Chapter 3 Under the Shadowless Lamp, Surgical Master. You are listening at novelfull.audio. That guy Wang Fan had already stabbed himself in the stomach before he passed out. Although it is not very big, it determines the direction of the incision. This gives me a headache. Su Chio frowned and kept glancing at her abdomen. After a few seconds, he quickly simulated a better incision. Su Chio calmed down and exerted some force on his hands. The sharp tip of the knife pressed gently against the skin. The blade of the knife cut open the skin along the incision point left by Wang Fan. In the blink of an eye, a standard max point appeared. Lu Susu ran over in a hurry, but it was too late. She turned pale and was about to lose her temper, but froze. This wound, it wasn't cut according to Wang Fan's markings. Moreover, Su Chio's choice was obviously better. This incision is so perfect. The capillaries and tiny nerves in the abdomen are avoided, so the amount of bleeding is pitifully small. There were only a few thin drops of blood. This is an abdominal incision, and the amount of bleeding after tearing off a little skin would be greater than this, right? Dr. Lu Susu was so frightened that she almost forgot that there was a patient under local anesthesia on the operating table. Su Chio held the scalpel and said without changing her face, "Do you have a mirror? Please help me take a look." "Yes, okay." When Lu Susu found a disinfected mirror, with the help of the vision reflected by the mirror, the subsequent surgery went much smoother. However, as the operation progressed, a fatal problem emerged. The wound is too small. The mirror cannot reflect the inside of the abdominal cavity at all. The choice left to Su Chio. All that was left was to forcefully expand the wound to gain a wider surgical field. Lu Susu swallowed her saliva and stared at Su Chio with some regret. For an appendicitis surgery, using mirror reflection can only sacrifice the wound and obtain a better surgical field. However, just then, Su Chio simply twisted her hand and inserted the forceps directly into the abdominal cavity. Lu Susu's eyes widened. This is a blind vision exploration. Under Lu Susu's incredible gaze, Su Chio's movements were smooth, without any stagnation. His proficiency in human anatomy allowed him to immediately identify various tissues: colon band, the top of the cecum. Finally, he decisively cut open the lateral peritoneum, inverted the ascending colon, and found the appendix. Treating the mesoappendix, ligating the mesangium, cutting off. At this moment, there was a rush of footsteps outside the operating room. The person who came was a resident doctor, and his qualifications were indeed not as good as those of Wang Fan. "Sister Lu, the surgery department asked me to do the surgery as soon as possible. This is my first time to perform surgery for appendicitis. If I do anything wrong, please," the resident doctor said as he entered the operating room, but the next moment, his voice stopped abruptly. The resident doctor looked horrified. What did he see? Is the patient operating on himself? Come here and help. On the other side, when Lu Susu saw someone coming, she quickly greeted him regardless of the other person's frightened expression. Oh, okay. The resident doctor suspected that he had made a mistake and came over in confusion, but the next moment, his expression became even more confused. Looking at it up close, the shock to him was even deeper than before. I have been a resident doctor for 2 or 3 years. It is his current dream to complete appendicitis surgery independently. It is also a difficult surgery, the choice of incision, exploration of the appendix. There are also the scope of root end resection, scanning methods, hemostasis methods, etc. Each process has a lot of knowledge. At this moment, the patient in front of him looked calm and was cutting his own appendix with ease. The resident was stunned. Su Chio's surgery was so smooth, it's like a work of art. In his life, he had only seen such perfect and coordinated surgical skills in some surgical teaching videos. What's even more frightening is that Su Chio's backhand is to perform surgery on himself. Thinking of this, the resident doctor suddenly raised his head and looked at Su Chio. At this moment, he felt that Su Chio's whole body was glowing under the shadowless lamp, the sublimated light belonging to the surgical master. The operation continues. After having an assistant, Su Chio's speed became much faster. Free appendix, ligate, cut off. Appendiceal stump hemostasis, buried purse string suture, cleaning, abdominal closure. The resident doctor was surprised. The stitching of this purse is so perfect that you can't find any flaws. In fact, it is even better than the example pictures in the textbook. Is this a purse stitch that can be done with a backhand? The resident doctor swallowed and felt his eyes were dry. Suture, though, is the basis of surgery, but to be able to practice this basic to this extent, even the director of the emergency department can't do it, right? I am afraid, only departments such as cardiology, vascular surgery, and neurosurgery that have extremely high requirements for suturing can train such suturing doctors. Senior, are you the deputy director of the overseas returnees, or the director? The resident doctor mustered up the courage to ask. It is nothing new for a top return doctor to become the deputy director or director of a certain department. They also have superb surgical skills. Su Chio's performance will only be better than that of those return doctors. But at this time, Su Chio shook his head and said truthfully, I applied for your hospital yesterday, but I was rejected. Resident? Can this be brushed off? Then at my level, I'm not even qualified to clean toilets in Linhai No. 1 hospital. I don't understand. The resident shook his head. Lu Susu was also confused. I don't understand either. While the two were talking, Su Chio had completed the final closing. He put down the needle pliers and said nonchalantly, send me back to the ward. Lu Susu and the resident doctor seemed to be in a dream. It wasn't until this moment that they turned around. Looking at the severed appendix on the tray, the two of them felt that their worldview had been refreshed. There are still people who can perform surgery on themselves. On the way back to the ward, the system voice finally sounded in Su Chio's mind. The experience settlement of the last surgery is here. Ding, congratulations on completing a case of acute appendicitis. Rating, a grade. EXP gained, 20. Ding. Congratulations on completing the mission. You've got a masterclass appendectomy. As soon as he finished speaking, a gentle force burst out from the depths of his mind, and then penetrated every cell in Su Chio's body. A large amount of surgical experience also poured into Su Chio's brain. This is a masterclass in appendicectomy. Su Chio was shocked. 3 common types of appendicitis, such as simple, suppurative, and gangrenous appendicitis, treatment methods, surgical details, and detailed surgical experience at every point of operation. He now seems to have become a specialist surgical master who has been immersed in appendicectomy for 30 or 40 years. Only if you don't do anything else in your life, but only perform appendicitis removal, can you have the opportunity to have such surgical ability. If he was asked to redo the surgery just now, even if you don't need a mirror, you can even turn off the shadowless lamp. Just relying on your touch and experience, you can achieve better surgical results than before. Unfortunately, I only have one appendix. Su Chio sighed twice. At this moment, a rapid voice came from the hall. Chapter 4 Random Mission, Car Accident Rescue. You are listening at novelfull.audio. Instantly, the entire emergency department hall was noisy again. Hurry up and open the emergency passage. Another car of wounded has been sent here. Those who are free, hurry up. Accompanied by the urgent call, the urgent sound of ambulance sirens suddenly sounded outside the hospital. Lu Susu's face became serious. She grabbed a passing intern and ordered, send the patient back to the ward. Interns are useless in such a big scene. They can only do some odd jobs, for example, push the patient back. Lu Susu turned and rushed to the emergency department hall and joined the rescue team. Seeing this scene, Su Chio felt a little powerless. The loss of the disease, the influence of anesthetics, and the physical damage and mental exhaustion caused by the operation made him very tired. He could only recuperate first. On the way back to the ward, Su Chio heard a lot of wailing. he tilted his head to look. In the emergency department hall, the wounded filled the passage, different partitions housed patients with different degrees of danger. There were still many injured people sitting on both sides of the corridor, their eyes were dazed, and they seemed not to have recovered from the major car accident just now. Critically ill patients were pushed to the emergency room with blood all over their bodies, and their family members knelt beside the waiting chairs in the hall, praying hoarsely with tears in their eyes. Crying sounded one after another. Su Qiu witnessed all these scenes, and his heart seemed to be twisted into a ball. The hospital was short of manpower, and even interns were dragged to the battlefield. If I join, maybe I can save one or two more people. He has a practicing physician certificate, although he has not been hired, but in an emergency, it is not considered a violation. Thinking of this, Su Qiu gritted his teeth and sat up from the bed while the anesthetic was still strong. "Classmate, put me down, I want to go." Su Qiu shouted, but found that the intern was tense and confused, and seemed not to hear what he said. He smiled helplessly. The scene of the major car accident was very tragic. Intestines were flowing out, brains were gushing out, and there were arms and legs all over the floor. It was normal for the intern to be scared out of his wits when seeing these things for the first time. Su Qiu didn't have the heart to disturb the intern. Taking advantage of the pause at the corner, he jumped off the bed and wandered around the emergency room. After a while, he found the lounge. He found a white coat and surgical slippers inside, and then joined the busy emergency team. "What's the patient's condition?" Su Qiu asked, pulling a hastily transported emergency flatbed. The nurse pushing the cart looked over. The moment she saw Su Qiu's face, her heart was moved. So handsome. However, the moment was not the time for romance, so she quickly reported. "There was heavy bleeding due to the car accident, and emergency compression has been performed to stop the bleeding." Su Qiu looked at the patient and quickly asked, "What's the pulse rate and pulse pressure?" The last pulse rate reported by the onboard instrument was 137, and the pulse pressure was 70/50ths. The pulse pressure difference was 20. Su Qiu nodded. "This is a typical shock patient. Moreover, it is the most serious shock. Loss of consciousness, cold limbs, cyanosis of lips. If he is not rescued as soon as possible, he may die at any time." Su Qiu checked the patient's neck. After confirming that the cervical spine was not damaged, he tilted his head to one side. "This is to prevent vomiting and suffocation during coma. It is the same as a drunk person lying on his side." With the triple cover of white coats, nurses and patients, Su Qiu successfully sneaked into the emergency room. Just as he entered the emergency room, a voice sounded in Su Qiu's mind again. Ding! Trigger a random task. Task requirements: rescue a car accident. Task rewards: generous rewards will be issued based on the rescue process rating, rescue success rate, number of rescued people, etc. Ding! During the random task, the experience points obtained will be doubled. Su Qiu was surprised. There was an unexpected gain. He cheered up and quickly got into the state. At the same time, the nurse had already started to transfer the patient to the rescue bed. Seeing this, Su Qiu quickly gave orders. Open 2 intravenous channels. High-flow oxygen inhalation. Urgent blood for blood gas analysis. Check electrolytes, creatinine, urea nitrogen, blood coagulation. Prepare bedside chest X-ray, pull ECG, electrocardiogram monitoring, urine routine. The nurses immediately got busy. The various instruments and catheters were connected to the patient. Su Qiu came to the bedside. According to the life monitor and the patient's clinical manifestations, he quickly determined the rescue drugs. Quick 2000 ml Ringer's solution. 200 ml of low molecular weight dextran every 10 minutes. Quick intramuscular injection of diazepam 10 mg. The emergency room is the place where adrenaline soars the most. A medication error or delay in timing may cause the patient to die, but at the same time, if the medication is used correctly and the timing is well grasped, the dying patient can quickly pull back the heart rate and escape from danger. He's back. As the drugs were injected, the values on the life monitor rose, and cheers broke out in the emergency room. Arrange the operating room and prepare for the operation. After Su Qiu finished speaking, he rushed to the next emergency room. In his mind, there was another voice. Rescue rating, S level. Number of people successfully rescued, 1. In the emergency room at this time, the nurses finally came to their senses as they watched Su Qiu go away. Hey, is there such a handsome doctor in our department? At the same time, the intern finally pushed the bed back to the inpatient ward, he said woodenly. Can you sit up? Go back to the bed by yourself. Shit, the intern was stunned as he looked at the empty flat bed. Where's the person? A living patient. He quickly called Lu Susu to report. On the other side, Lu Susu was helping to transfer and classify the patient's risk level in the emergency channel. When she looked up, she suddenly saw a familiar handsome face. The other party was shuttling between the emergency rooms and participating in the rescue, Lu Susu said blankly. I'm so tired that I'm hallucinating. How could someone who had just finished surgery appear in the emergency room? She shook her head, pushed the patient's flat bed, and rushed to the operating room. On the way, her work phone rang. She quickly picked up the phone. After a moment, Lu Susu suddenly turned back to look in the direction of the emergency room and said in shock, is that Su Qiu? In the emergency department lobby, in the emergency room, Deputy Director He Hai was in a hurry, shuttling between the emergency rooms. As the Deputy Director, he did not need to participate in routine rescue, only those rescues that were ineffective according to the procedures, or emergency events, would he be asked to take over. Needle aspiration, I guess there is internal bleeding in the abdominal cavity. In an emergency room, He Hai listened with a stethoscope for a few seconds and made a judgment. The doctor in the operating room immediately did so. After a moment, a tube of dark red blood appeared in the empty needle tube. At the same time, the patient's heart rate began to rise after falling, and soon returned to normal. It's done, Director He, it's amazing. Everyone in the emergency room was excited. He Hai nodded slightly, put his hands behind his back, and walked calmly to the next emergency room. As soon as he opened the door, his face suddenly changed. Chapter 5, Surgical Video. Everyone in the emergency department was shocked. You are listening at novelfull.audio. Beside the bed, several nurses were running to rescue the patient. The doctor who issued the rescue order was leaning against the wall, holding a needle in his hand and stabbing his lower abdomen. Su Qiu. The moment he saw this doctor, He Hai was a little confused. Why is Su Qiu here? Let's not talk about his failed application. Didn't this guy just have an appendectomy? Why did he come to the emergency room? Director He. Su Qiu injected lidocaine and infiltrated it layer by layer, and the severe pain of the wound was finally relieved. You are. He Hai took 3 or 2 steps, picked up the medicine bottle next to him, and immediately understood. He glanced at Su Qiu's wound. Because of the intense exercise, the sterile dressing covering the wound had fallen off. However, there was no extra bleeding from the exposed wound, and the wound was neatly aligned, with almost no tension, and the stitch distance and margin were perfect and there was no flaw. It's a great job. The resident doctor can do this? He Hai was amazed. Su Qiu, I sewed it myself. He Hai suddenly raised his head and stared at Su Qiu. Are you kidding? Why didn't the surgeon in that operation sew it? Backhand sew, can it be sewed like this? What a solid sew ability. Su Qiu said lightly, in fact, I am the surgeon. He Hai's expression was even more shocked. What? It took him a while to understand what Su Qiu meant. Appendectomy. You did it yourself? Su Qiu nodded. At this moment, a surprised call came from the rescue bed. Dr. Su, the patient's condition has stabilized and he is back. Beside the bed, the sweaty attending physician cast a grateful look at Su Qiu. He was in charge of this patient. The patient had been successfully rescued, but the situation suddenly took a sharp turn for the worse. 4 or 5 injections of adrenaline were useless. If Su Qiu hadn't arrived in time, the patient would have been in danger. When He Hai saw this scene, he was more shocked than ever. This is one of the best attending physicians in the emergency department. One rescue operation convinced this arrogant attending physician. He Hai finally realized that Su Qiu was not simple. He patted Su Qiu's shoulder meaningfully and asked, you came here just after the operation? Su Qiu, yes. How many rescue operations have you participated in? 7. Did they all come back? Yes. Su Chiu answered calmly. On the other hand, He-Hi's heart was already in turmoil. No wonder he didn't feel so much pressure this time. It turned out that there was an extra tough guy who directly won 7 critical rescue operations. He-Hi was silent for a long time. He thought of Su Chiu performing surgery on himself, and the perfect suturing technique. After pondering for a long time, He-Hi raised his head and suddenly stretched out his hand to Su Chiu, saying in a serious voice, "Dr. Su, I made a mistake yesterday. On behalf of the emergency department, I specially hired you as a doctor in our hospital, and hope to work with you." At this moment, the rescue room was extremely silent. The doctors and nurses all widened their eyes, with a look of disbelief on their faces. Missed. This doctor with superb medical skills and control of the whole scene, was actually eliminated yesterday. Then those who were recruited in, wouldn't it be even more outrageous? In the shocked eyes of the people, Su Chiu stretched out his hand, shook hands with He-Hi, smiled faintly and said, "Director He, happy working together." Half an hour later, the injured in this major car accident were finally digested. All 32 injured were rescued. Afterwards, those who should be scheduled for surgery will be scheduled for surgery, and those who need to recuperate will rest. Everyone in the emergency department finally ushered in a brief respite, except He-Hi, Su Chiu, and Lu Susu. At this moment, the 3 people were rushing to the surgery management department. After copying the video of the appendicitis surgery, the 3 returned to the conference room. At this time, there were already several people sitting in the conference room. Another deputy director of the emergency department, Wang Fan, who woke up. There were also several senior attending doctors who were one step away from the deputy director. Everyone looked very tired, but the spirit was extremely excited. Staring at Su Chiu, who came in from the door, Wang Fan also showed an apologetic smile. "Director He, can he really perform surgery on himself?" someone asked. Moreover, he ran to the emergency room to save people right after the surgery, saving a total of 10 people. Can such a person be eliminated? Everyone was full of incomprehension. He-Hi didn't waste any words and asked Lu Susu to play the copied video. As the big screen in front of the conference room flashed, everyone's eyes were attracted. The recording of the surgery started after Wang Fan was carried out. Soon after, the screen turned to the operating table. In the video, Su Chiu picked up the scalpel. After a brief thought, he cut a standard McBurney point on his lower abdomen along the incision left by Wang Fan. Everyone was surprised. Not cutting along the marked line. This incision choice is obviously better than Wang Fan's. He-Hi's pupils also dilated. He is the deputy director and sees more than others. Su Chiu not only made a good incision, but also made the incision along the skin folds. This means that after the wound heals, the scar left behind will be very small. An expert can tell the depth of the wound with one cut. Many attending physicians, when doing this kind of surgery, only make incisions mechanically according to the textbook, ignoring the individual differences of people. But Su Chiu, even took the healing of the wound into consideration. Without hundreds of surgeries, it is impossible to hone it. At this moment, He-Hi knew that he really made a mistake. Fortunately, it was retained in the end. He-Hi sighed and looked at the video again. As the operation progressed, Su Chiu's movements became more and more smooth. If you ignore the awkward movements, Su Chiu's smooth exploration and excision would not be seen as performing surgery on himself. The blind field detected an ectopic appendix. This. How familiar is he with human anatomy? Exclamations were heard from time to time in the conference room. People don't understand how Su Chiu can perform the operation so easily, more perfect than many doctors performing surgery on patients. After the video of more than 10 minutes was played, the conference room was silent. Everyone was still in shock. Everyone had only one thought in their mind. This operation is simply a work of art, silky and effortless. This video can become a teaching video for appendicitis surgery in minutes. Amazing, Dr. Su, welcome to join the emergency department of Linhai First Hospital. After a short silence, another deputy director took the initiative to stand up and smiled kindly at Su Chiu. The others also stood up to welcome the new colleague. Amid the welcome applause, Wang Fan touched his head and said apologetically, "Dr. Su, I followed the big operation last night. I didn't eat for a day and fainted in the morning." "I'm sorry." Su Chiu smiled and said, "It's okay. If it weren't for you, I might not have the opportunity to be the main surgeon. Ha ha ha, that the conference room laughed loudly. At this time, Wang Fan said again, Dr. Su, will you be on duty with me tonight? That he had just been promoted to attending physician not long ago, and the night shift was particularly busy. In addition, he was the only male doctor in their group, and he did the most work. Wang Fan had long wanted to find a resident doctor to follow him. As a result, before he could finish his words, a stern, blaming voice suddenly sounded. Warm reminder, if you find that clicking the next page will force you to jump to other websites, please use the chapter error or contact us at the bottom to inform us. We will handle it as soon as possible. Thank you for your understanding. Chapter 6, Become Famous. Obtain master-level bone reconstruction skills. You are listening at novelfull.audio. He Hai said, what kind of shift is it? Su Chiu just finished the operation, and he needs to rest for at least a few days. After saying that, he cast an admiring look at Su Chiu. He would rather hold on with lidocaine than sit back and watch the wounded. Such doctors are becoming increasingly scarce in today's world. He Hai knew in his heart that, this time, he specially hired not only a capable doctor, he is also a medical craftsman with medical ethics. Thinking of this, his tone softened a lot, and he said to Su Chiu, go back to the ward first, and rest well before going back to work. In a flash, 3 days passed. During these 3 days, He Hai, Wang Fan and others would pay special attention to Su Chiu when they made rounds. What shocked them was, Su Chiu's wound, even if he exercised vigorously within a few minutes after the operation, he even took several anesthetics that affected the injury, but, the healing effect was still very good. Lu Susu, who was in charge of nursing, was also stunned. She has been a nurse for 5 or 6 years, and she has never seen an appendectomy incision heal so well. At the same time, as the major car accident incident fermented and ended, the glorious achievement of more than 30 injured people and 100% treatment rate also made Lin Hai First Hospital a little famous. Moreover, a reporter captured the scene of Su Chiu injecting lidocaine. For a time, this photo went viral on the internet. Handsome appearance, white coat, and medical ethics of injecting medicine in pain just to maintain the state and save people, the 3 labels combined made Su Chiu's fame spread all over the internet. In the ward, Lu Susu said with a smile while changing the dressing for Su Chiu. Dr. Su, you are almost a celebrity in our emergency department. Many girls have specifically asked to register with you. After that, her soft fingers slid over Su Chiu's abdominal muscles. This mermaid line, no, this wound heals so beautifully. Su Chiu looked at Lu Susu, even wearing a loose nurse uniform, it couldn't hide her pear-shaped figure. Noticing Su Chiu's sweeping gaze, Lu Susu blushed. Then, she felt Su Chiu's abdominal muscles harden a little more. She couldn't help but glance down. She couldn't help swallowing her saliva. After realizing what she had done, Lu Susu immediately panicked. The medical department has prepared your work badge and clothes for you. When you recover, Dr. Su, you can go to work at any time. After saying that, she bit her lip and ran away quickly. Su Chiu laughed a few times, retracting his gaze. He turned his attention to the system interface. It's time to receive today's sign-in reward. In the last temporary rescue mission, he treated a total of 10 people with a 100% success rate. Therefore, he obtained a rare and difficult surgery, master-level lower limb bone reconstruction. And today's sign-in reward. Ding! The sign-in location impact factor is 1.3, and the reward is slightly increased. Get a random reward, perfect level bare hand hemostasis method. Seeing this reward, Su Chiu's eyes lit up. Perfect level. The first perfect level technique. It's a bit regrettable that the bare hand hemostasis method has long been abandoned by the times. Hemostatic forceps and bipolar electrocoagulation have long replaced the emergency bare hand hemostasis in wartime. The only occasion where it can be used is probably out-of-hospital emergency treatment, but, after Su Chiu was indoctrinated with the perfect level bare hand hemostasis method, his concept was overturned. The bare hand hemostasis below the master level may indeed be inferior to other hemostasis methods, but the perfect level has crossed the technological gap and reached a new height. He can even use the touch of his hands to sense the bleeding points and easily stop some undetectable bleeding points. It's simply a human-shaped hemostatic drug. Su Qiu sighed, this wave is worth it. In the afternoon, Su Qiu's ward welcomed a new patient. She was a 20-year-old female college student. Like Su Qiu, she also had acute appendicitis, however, she was in the preparation stage. Once the fasting was completed and all the examinations were completed, she could go on stage for surgery. As soon as she came in, she kept looking at Su Qiu. Finally, after half an hour of psychological preparation, she mustered up the courage to ask, Are you the Dr. Su on the internet? Su Qiu opened his eyes and glanced at the other party, looks very young. It's me. My name is Qin Xiao. I'm a medical student at Linhai University. That the female student was so excited that she stuttered and added. It's really you. Dr. Su. Can I let you perform appendectomy on me? Su Qiu moved his abdominal muscles, the wound above has almost recovered, just in time, do an appendectomy and completely recover. By the way, he also wants to try the master-level appendectomy ability. Thinking of this, Su Qiu nodded and agreed. The next day, Su Qiu was officially discharged from the hospital. He took off his hospital gown and put on a white coat. He was ready to perform the first formal operation. At this time, Qin Xiao's preoperative preparations were also completed and she was pushed into the operating room. Before Su Qiu went on stage, the emergency department suddenly held a hospital-wide consultation. He asked about the situation. Lu Susu said, Dr. Su, you don't need to attend the consultation if you want to have surgery. This consultation was actually with a girl who was in a car accident 3 days ago, the daughter of a certain director. Her leg fracture was very serious, and amputation was the only option, but she couldn't accept it, so her father contacted a domestic bone reconstruction expert, hoping that he could help see if replantation could be done. Su Qiu was a little surprised. Lower limb bone reconstruction. I have a master-level reconstruction technique. After this operation, he can just join in the fun. Half an hour later, in the operating room, everything is ready. Patient's name, Qin Xiao, female, 20 years old, hospital number 037561XX, preoperative diagnosis, acute appendicitis with perforation, planned operation, appendectomy, anesthesia, continuous epidural block anesthesia, surgeon, Su Qiu, first assistant. Intern, wait, in addition, Wang Fan is here too. He really wants to witness Su Qiu's surgical ability with his own eyes. In this way, he can be sure of what tasks to assign to Su Qiu in the future. After all, Su Qiu is only a resident doctor now, he has to follow Wang Fan, the attending physician. On the other hand, Qin Xiao on the operating table was very nervous. When Su Qiu came to comfort her, she said uneasily, Dr. Su, do you mind that your girlfriend has a scar on her stomach? Su Qiu smiled warmly and said, Don't worry, I will try my best to sew it well, and there will be no wound after it heals. Hearing this, Qin Xiao felt dizzy, so gentle, handsome and gentle. Just when she was still immersed in the gentleness, Su Qiu had already come to the position of the main surgeon, holding the scalpel, and his eyes immediately became cold and sharp. Just then, Qin Xiao suddenly gasped. Su Qiu's face changed slightly. Chapter 7 Top experts say no. Do you think there is still a chance? You are listening at novelfull.audio. Anesthesia is not done. He looked at it, and Qin Xiao blushed and explained, I'm a little excited. Su Qiu was silent. Is this girl a bit masochistic? He shook his head and put his attention back on the operation, cut the skin and subcutaneous tissue in turn. Because there was very little bleeding, the step of ligation to stop bleeding was omitted. Then, change the knife to cut the anterior sheath of the rectus abdominis and separate the rectus abdominis. Number 4 Silk thread. Clamp the blood vessels and cut them off. Number 4 Silk thread quickly ligated, then cut the posterior sheath and peritoneum. Wow! At this moment, a large amount of light yellow thin pus gushed out. Qin Xiao raised her head to see herself being dissected. After a while, she lay back in distress. Her sight was blocked by her own fierceness. At this moment, she realized that being a girl who can't see her feet when she lowers her head also has troubles. 10 minutes later, Su Qiu used number 7 silk thread to suture the anterior sheath of the rectus abdominis muscle, and then used number 1 silk thread to suture the subcutaneous tissue and skin. After the last stitch was inserted, he put down the needle holder and looked at the time. The instrument nurse reported consciously. The operation took 10 minutes and 21 seconds. After that, she praised in surprise, "Dr. Su, you set a record for appendicitis surgery in our emergency department." Beside the operating table, Wang Fan stood silently. At this moment, he began to doubt his life. Watching closely, Wang Fan felt more that Su Qiu's surgery was impeccable. Is this really a job seeker who was eliminated by several hospitals? With such a level of surgery, he is not even qualified to polish Su Qiu's shoes. Wang Fan stood silently in the corner. At this moment, he realized that he was probably not qualified to arrange Su Qiu to do odd jobs. It would be good if he could help Su Qiu and keep up with Su Qiu's surgery rhythm. After stepping down, Chen Xiao's bestie was waiting outside the door. The best friend is also a beautiful female student. As soon as she saw Su Qiu, she came up excitedly, took out her phone and asked for a photo. Su Qiu squatted down, took a photo with the other party, and asked, "Don't you care about your friend's surgery?" "It's okay, if she fails, all our dormitory members will be admitted to graduate school, ha 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 ha." Wang Fan and others couldn't help laughing. Su Qiu still explained a few words briefly, saying, "Rest in bed for a few days, and the stitches will be removed in about a week." After that, he hurried to the meeting room. "I hope I can catch up with the whole hospital consultation. On the way, the settlement reward for this operation has also arrived. Ding! Congratulations on completing an acute appendectomy. Rating, S level. Congratulations on getting 30 experience points. You get an additional 3% master level appendectomy proficiency. Su Qiu was surprised. S level rating will actually reward extra proficiency. When the proficiency accumulates to 100%, you can automatically advance to perfect level appendectomy. The experience value has also risen to 90. There is one last operation left, and then we can draw the lottery. Su Qiu was a little excited. "I wonder what the prize for the lottery will be." Thinking like this, he rushed to the conference room in a short while. At this time, the condition had already been discussed inside. He entered from the back door and quietly found a seat to sit down. Scanning around, the conference room was full of people, except for the director and deputy director of the emergency department. There were also directors of other related departments. Even the dean came. In addition, a space was vacated next to the conference table. There was a bed there, and the person lying on it should be a patient. Sure enough, powerful people can make exceptions even in the hospital. After looking around, Su Qiu cast his eyes on the director of orthopedics who was speaking. At this time, the director frowned and said, "After so much discussion, the safest way is amputation." A middle-aged man in a tang suit, with a gloomy face, asked, "Can't the leg be reattached?" The director of orthopedics shook his head solemnly. "The best transplant time for replanting a broken limb is 6 to 8 hours. This is still the case when the broken limb is well preserved. However, Ling Qinjin's left leg, our hospital has tried all methods in the past few days and it is confirmed that it is impossible to replant successfully." Director Chen, who was wearing a tang suit, leaned back in his chair and suddenly looked 10 years older. The director of general surgery said at this time, "Director Chen, we have already 3D printed a titanium alloy prosthesis. I wonder if expert Lin has any way." Hearing this, a gleam of light flashed in Director Chen's eyes. 3D printing titanium alloy prosthesis replantation is a brand new technology in the world. The materials are expensive, the surgery is expensive, but what he lacks the least is money. Director Chen quickly looked at Lin Xie who was sitting next to him and said, "Expert Lin, can my daughter get a prosthesis?" Lin Xie said with some embarrassment, "The risk is very high." "Very high." Director Chen's face darkened a little. Lin Xie explained, "Director Chen, you are one of us, so I will tell you the truth openly. In China, the technology of titanium alloy prosthesis reconstruction is not mature enough. Moreover, most of them are used after early bone resection of benign bone tumors. Your daughter just experienced a car accident. It was not until today that she recovered and had the opportunity to undergo surgery, but, until now, the condition of her left leg is not optimistic. In this case, the success rate of prosthetic reconstruction. I can only say that there is no such precedent in China yet." After that, Lin Xie pressed the imaging report on the table and pointed to the tibia and said, Director Chen, look here, her leg is severely damaged and there is no place to fix it, moreover, the shunt can't last until the bone reconstruction. At present, amputation is the only option. Director Chen's eyes dimmed completely. Lin Xie is one of the top orthopedic surgeons in the industry, especially in lower limb surgery. If he said no, it was basically equivalent to the death sentence from the King of Hell. At the same time, on the bed next to her, Chen Mengxian looked gloomy when she heard this, and felt that her last hope was shattered. She is a dancer. It can be said that dance is her lifelong love. For her who loves dance, the outcome of amputation is completely unacceptable. It is simply a disaster. Just when she was desperate, Su Qiu finally finished reading Chen Mingxuan's medical records and imaging films. In these few seconds, Su Qiu made a completely different judgment on Chen Mengxian. No, there is still a chance for bone reconstruction. Accompanied by this extremely young voice, surprised, amazed, angry and other different eyes focused on Su Qiu at the same time, the dean, the director of orthopedics, the director of general surgery and others were all furious. He Hai, the deputy director of the emergency department, was panicked. This kid is ignorant of the times. Lin Xie has already said no, how can you say there is still a chance? Nonsense, get out. The dean slammed the table and suppressed his anger. If Director Chen had not been present, Su Qiu might have been punished on the spot. Director Chen's face was also extremely ugly. Are you, a young man, more capable than Lin Xie? Dean Wang, the quality of young doctors in your hospital needs to be improved. Director Chen said in a gloomy voice with anger, just when everyone was dissatisfied. The scene that happened at the next moment made everyone dumbfounded. Chapter 8 Either amputation or death. Su Qiu, no, there is another way. You are listening at novelfull.audio. At this moment, Chen Mengxian suddenly screamed in the hospital bed. Director Chen rushed over immediately. He held his daughter's suddenly white face, his body trembling. Daughter, what's wrong with you? The others no longer bothered to blame Su Qiu, and rushed forward to check the situation. The pulse is thin, the skin is cold, and the pulse is also fast, a sign of shock. The director of the Department of Surgery quickly lifted the quilt and checked Chen Mingxuan's general condition. As soon as he saw it, his expression changed. Heavy bleeding. At this time, a large amount of blood had accumulated in Chen Mingxuan's left lower limb. Look at the degree of swelling, and the reaction of Chen Mingxuan's body. The amount of bleeding is expected to be about 800 milliliters. At the moment, the directors did not dare to neglect and stop the bleeding on the spot. The amount of blood loss is not much. If it is stopped in time and the blood volume is replenished in time, it will not be a serious problem. However, Ling Qinjin's toe has already shown symptoms of ischemia, and now the only option is amputation. The director of the emergency department discovered that Chen Mingxuan's toes were black. This represents ischemic necrosis. Her leg should have been amputated a long time ago, and it is a miracle that she is still holding on until today. Lin Xie came over to take a look, but also shook his head repeatedly and said, Director Chen, there were some opportunities before, but now, the symptoms of necrosis have appeared. This meant she had to remove the entire tibia and even have the bone rebuilt up to the femur. This kind of surgery is extremely rare, not to mention domestically and internationally. Hearing this sentence, Chen Mengxian was breathing more and more rapidly on the hospital bed. His expression became darker and darker, and he felt like the sky was falling. I can't dance anymore. She held her father's hand, tears of despair sliding down her cheeks, but at this moment, she seemed to remember something and suddenly turned her head to look at Su Qiu in the corner of the conference room. He said he can rebuild bones. Dad, I want him to come. Chen Mengxian said hoarsely. Director Chen was worried a moment ago, but when he turned to look at Su Qiu, his eyes immediately changed. It was a look that wanted to kill. It is a cruel thing to let your daughter accept the tragedy calmly. Su Qiu's words undoubtedly rubbed salt into his daughter's wounds. As a father, how could he not be angry? Is it possible that a doctor in his 20s is more capable than Lin Xie? Before he gets angry, suddenly, the director of the Department of Surgery beside him said in a low voice, the bleeding can't stop. The director of the emergency department also stood there dryly. The two of them tried various methods, but the bleeding point can't be found. I come. Lin Xie put on his gloves and took their place. He glanced sideways at the other directors. There was some disdain in my heart, as expected. He is the top 3 in a small place. The director is only at this level, but it's normal, otherwise how can he show his professionalism? With this idea in mind, Lin Xie quickly carried out the hemostasis procedure. After a while, the blood on the tibia surface became clean. He breathed a sigh of relief, stuffing a piece of gauze inside. He said at the same time, "Her wounds are severely damaged, and it's understandable that you didn't stop the bleeding." However, before he finished speaking, a little bit of red smeared out from under the white gauze. In the blink of an eye, it turned into a bloody gauze. "Don't stop." Lin Xie's pupils dilated and a few drops of cold sweat broke out on his forehead. He quickly sucked up the congestion, explored again, and stopped the bleeding. Lin Xie's face was sweating more and more. There are more and more red gauze beside it. It was still dark red congestion at first. At the back, the gauze turned bright red. "If the bleeding doesn't stop, just amputate it." Lin Xie suddenly raised his head, and a drop of sweat slipped into the mask. Director Chen was stunned. Amputation and bone reconstruction are 2 completely different surgeries. If you choose amputation, it means that it is basically impossible to reconstruct the bone later. It's not a matter of one leg now. If you don't amputate the leg and stop the bleeding once and for all, your life will be lost. Lin Xie said solemnly. Chen Mengxuan's heart gradually became cold. She tilted her head feebly and looked at Su Qiu again. At this moment, a glimmer of hope suddenly sprouted in her heart. Her haggard eyes widened, and her expression was full of pleading. Seeing this scene, Su Qiu finally couldn't sit still. This time, he didn't say hello. Chen Mengxian couldn't make the decision in the hospital bed. He made it clear in advance that he would inevitably be rejected, so I can only do it forcefully. Facing Chen Mengxuan's delighted gaze, Su Qiu walked forward step by step, putting on her gloves. After approaching Chen Mengxian, he turned sideways, squeezed in from beside Lin Xie, and then inserted one hand into Chen Mengxuan's dissected tibial wound. Perfect manual hemostasis method. Bastard! Lin Xie's expression changed drastically and he was about to reprimand him. On the other side, the nurse's voice suddenly sounded. "Blood pressure, stabilized." "What?" Everyone looked at the monitor at the same time, their expressions full of disbelief. "Expert Lin, don't touch him." At this moment, everyone's conversation changed. Anyone with a discerning eye can see that Su Qiu held down the culprit of the bleeding. Otherwise, blood pressure cannot be stabilized immediately. Lin Xie quickly raised his hands and took 2 steps back. At this moment, no one dared to touch Su Qiu. Only a pair of surprised eyes were still looking at the young doctor. At the same time, Chen Mengxian weakly raised her head. She stared at the handsome doctor with a focused expression, and her weak heartbeat suddenly accelerated a few points. "Dad, I want him to do the operation." Chen Mengxuan's voice rang out in the silent conference room, but people still felt it was absurd, although it was unclear how Su Qiu stopped the bleeding with his bare hands. But hemostasis and bone reconstruction are not things of the same difficulty level at all. Director Chen finally hesitated at this time, looking at his daughter's eyes that had regained their vitality. He deeply realized the significance of that leg to her life. Director Chen turned his head to look at Lin Xie. After a moment, Lin Xie sighed and said, "It's not impossible. I can try bone reconstruction, and if it fails, just amputate directly. But in that case, the range of resection may be larger, and the cost of the operation will be higher." "Daughter." This time, Director Chen gave up the opportunity to make the decision. Chen Mengxian was surprised at first, but soon smiled and said, "Okay, I'm willing to take this risk." The surgical plan was quickly determined. Moreover, Chen Mengxian had already completed chest CT, abdominal plus pelvic enhanced CT, whole body bone scan, tibia and fibula enhanced CT and MRI and other examinations. Therefore, when the surgery was decided, she could already be pushed onto the stage. On the way to the operating room, He Hai, the second-to-last position on the scene, re-reported the key information, and Su Qiu, acting as a human hemostatic device, pressed Chen Mengxuan's tibial blood vessels, remained relatively still with the bed, and moved horizontally to the operating room. Listening to He Hai's report, Su Qiu's expression gradually showed a hint of surprise. Chapter 9. How could his surgical skills be better than mine? You are listening at novelfull.audio. What surprised him was that the prosthesis given to Chen Mengxian had already been reconstructed. It is stored in the hospital, waiting for the operation to begin at any time. This is a very rare situation. Prostheses are not cheap, and Chen Mengxian uses top-grade imported materials. The cost of a reconstructed body is as high as 200,000 to 300,000 yuan. The other party didn't even confirm that they wanted bone reconstruction, just for a possible solution, just order it directly. Su Qiu glanced at the design of the prosthesis: bone cement intramedullary needle, smooth titanium alloy components. There is also size control precise to microns. The cost of this thing is estimated to be enough to make an average person's salary for several years. Escort all the way to the surgery area. Su Qiu alternated her hands, and with the help of her assistant, she completed preoperative hand brushing and dressing, and then entered the operating room. As for Director Chen, no matter how powerful he is, for the safety of his daughter, he has to undergo operating room training before he can come in to observe. In the operating room, Chen Mengshuan's face was full of uneasiness. Only when she looked at Su Qiu, she felt peaceful for a moment. She said with a trembling voice, "Dr. Su, will something happen to me? Can I still dance?" Su Qiu turned her head, with a smile as healing as the spring breeze, and said, "Get some sleep. When you have a performance in the future, I will watch you dance." After hearing these words, Chen Mengshuan's frightened heart suddenly calmed down. She lay obediently on the stage and smiled weakly. "Yes, I will dance well and wait for you to come and see me." After comforting the patient, the anesthesiologist came up to perform general anesthesia with tracheal intubation. Gradually, Chen Mengxian felt her eyelids getting heavier and heavier, then she tilted her head silently and passed out completely. The anesthesiologist's voice just sounded, "It's done." The equipment nurse then said, "The prosthesis has also been delivered and can be started at any time." Lin Xie stood in the main seat and took a deep look at Su Qiu. He still hasn't figured it out yet. How on earth did Su Qiu stop the bleeding with her bare hands? He, one of the best bone reconstruction experts in the country, tried various methods to stop bleeding but was unable to do anything. Did the other party stop with just one hand? This is so magical. Forget it. He must be lucky. The current bone reconstruction surgery is not a matter of luck. Without decades of experience and thousands of surgeries, it would be impossible to do it. He is the only one in the country who dares to challenge this extremely difficult prosthetic reconstruction. Thinking of this, Lin Xie's expression showed a hint of confidence. The next moment, he gave the order, "Start the operation." Although Chen Mengxian named Su Qiu to do it, however, everyone just tried to coax her when she was awake. If he really passed out, the only person who could do the surgery would be Lin Xie, the top expert in the country. Hook. Lin Xie bypassed Su Qiu's pressing hand and stretched the tibial anterior muscle group, anterior tibial nerve, deep tibial nerve, etc. that could still be reconstructed. When judging the scope of resection and the site of reconstruction, Lin Xie's expression became more solemn. The entire operation just now, Lin Xie has no instructions. He had just completed the separation of the previous section of blood vessels and nerves, and when he wanted to find the next one, Su Qiu actually adjusted the position of his hand directly. There is no obstruction to the view at all. This feeling, although the description is very inappropriate, she really looks like a 30-year-old young woman. Just pat the butt and ass, and the other person will know that it's time to change positions. Are you really going to do this surgery? Lin Xie's face became more and more incredulous, and he finally couldn't help but ask. Such tacit cooperation is something even the director who has been operating with him all year round cannot achieve. There is only one possibility: Su Qiu's control over the rhythm of the surgery was equal to him, or even better than him. But, how is this possible? Have you had bone reconstruction surgery before? Lin Xie confirmed again. Su Qiu moved her hand and just replied, "I can do it." The reward he received was a master-level bone reconstruction technique. Bone reconstruction is an extremely difficult surgery. Those who can reach the master level, looking around the world, I'm afraid there aren't many. Therefore, even Lin Xie, the top expert in the country, acted in front of him at this moment, and his actions seemed a bit childish. On the other side, seeing Su Qiu's expression so calm, Lin Xie seemed to be turned away. He simply ignored Su Qiu and concentrated on the operation. Soon, the tibia was completely exposed. Under the shadowless lamp, there was only a blur of flesh and blood. Making it difficult to identify various anatomical structures, Lin Xie spent a lot of effort and finally got it done. The expected resection length before the operation was 13 centimeters, but now the situation is worse. At least 19 centimeters must be removed. When it came time to determine which bone segment should be removed, Lin Xie's face looked a little ugly. 19 centimeters. The risk of such a large-scale resection is too high and the success rate is too low. It is far less safe than amputation. At this moment, he was already planning to give up on reconstruction. It is necessary to install the tibial prosthesis, and to connect all the nerves, blood vessels, tendons, etc. in the tibia, knee joint, and foot. Not many people can perform such a complicated surgery. Lin Xie shook his head and sighed, but the movements of his hands did not stop at all, and he began to try to remove the waist bones. Suddenly, a stream of bright red blood spurted out and hit Lin Xie's eyes instantly. The equipment nurse's expression changed and she quickly wiped his glasses. Lin Xie's expression immediately became solemn. Although his glasses were blocked by blood, he still pressed the bleeding artery by feeling. His voice was low. The posterior tibial artery, why is it here? After cleaning his glasses, he looked into the cavity. The posterior tibial artery was marked. It had obviously been ligated. Su Qiu was also a little surprised, but he immediately judged the reason and said, "The patient's injury has been delayed for too long. The artery has retracted near the tibia, and several sections of the posterior tibial artery are buried in the flesh and bone." Lin Xie's eyes lit up, however, his expression also became serious at the same time, and he said, "In this case, reconstruction is not possible and amputation should be considered." Lin Xie shook his head. There was nothing he could do to save his life. He thought he had isolated all the important blood vessels and nerves, but now it seems that the situation is several times worse than he imagined. He accidentally cut an artery, causing blood to spurt out, but in fact, he may have accidentally cut a vein or nerve just now. These important structures are all hidden in the vague flesh and blood, coupled with Chen Mengxuan's reduced blood volume and deflated blood vessels. There is no way to separate it. Give up on rebuilding. Lin Xie sighed and was about to make the final decision. Sudden. At this moment, Su Qiu, who had been waiting and watching, spoke. Chapter 10 An Jing, Su Qiu does better than me. You are listening at novelfull.audio. Su Qiu interrupted Lin Xie. Teacher Lin, can you let me try it one last time? That the sound is smooth and reassuring. Lin Xie cast a questioning look. You? I only need 5 minutes. Su Qiu requested. Lin Xie hesitated. Logically speaking, a resident doctor is not even qualified to perform this kind of surgery. However, thinking of Su Qiu's performance just now and the condition of blood vessels and nerves that he could judge at a glance, Lin Xie hesitated a little. 5 minutes, right? Okay, I'll give you 5 minutes. Lin Xie roared in a deep voice, simply treating the dead horse as a living horse. Doctor, 5 minutes won't delay anything. The worst case scenario is amputation, allowing this young doctor who can't even see through himself to show off his skills. Lin Xie made a decision and turned sideways, ready to take over Su Qiu's compressions and let him do the surgery. He found the right place for Su Qiu to press, and also used his bare hands to stop the bleeding. But as long as Su Qiu lets go, no matter how hard Lin Xie presses, he will still bleed. At this moment, Lin Xie suddenly understood that Su Qiu's bare-handed method of stopping bleeding was not simple. If it were someone else, even if they were in the same position, the force or angle would be wrong, and they wouldn't be able to stop the bleeding. Before, Lin Xie thought Su Qiu wanted to get a surgery. Now Lin Xie finally realized that it wasn't that Su Qiu didn't want to use other methods to stop the bleeding, but, except him, no one else or other methods could stop it. I come. Seeing that Lin Xie couldn't figure it out, Su Qiu became a little anxious. The opportunity for surgery that was finally obtained should not be lost because Lin Xie could not stop the bleeding. He held Lin Xie hand in hand, controlling Lin Xie's strength and angle. That's it, hold on. After saying that, Su Qiu slowly and gently let go of his hand. Check the gauze again, no bleeding. Successful. Lin Xie's eyes flashed with excitement. Su Qiu nodded. Not bad. Then, he arrived at the position of the surgeon and officially took over the operation. At this moment, Lin Xie, who had taken the place of Su Qiu's human hemostat, was stunned. The top expert was praised by a resident doctor in his 20s. Moreover, he taught me how to stop bleeding. Thinking of the scene just now and the involuntary joy when he finally succeeded, Lin Xie suddenly blushed. I've lost all face. But Lin Xie didn't expect that this was just the beginning. The moment Su Qiu stood under the shadowless lamp, his whole aura changed. His eyes instantly became sharp, his expression was stern, like a rigorous machine, in the incredible eyes of everyone. Su Qiu picked out the blood vessels and nerves hidden in the broken flesh and blood. Be obedient. Then, continue the osteotomy that Lin Xie left unfinished. Only, Su Qiu did not follow the 19 centimeters set by Lin Xie, but it is cut off at 11 centimeters. 11 centimeters. Lin Xie was confused. The best-case scenario predicted before surgery was to remove 13 centimeters. The actual judgment during the operation was that 19 centimeters should be cut off. What's the situation now? Lin Shigan wanted to question, but when he saw the intact blood vessels and muscles hidden under the severed bones, he fell silent. Others also looked at this scene blankly. Golu, I don't know who swallowed the saliva. The director of orthopedic surgery standing outside stretched his neck, fearing that he would not be able to see the wonderful surgical process. He said dryly, this doctor is only in the emergency department. The director of the Department of Surgery glared at the director of the emergency department bitterly. With such a genius, you are still complaining to me that you want people from our Department of Surgery? The director of the emergency department was also confused. I don't know. Deputy Director He Hai coughed dryly. Actually, Su Qiu was specially hired by me. For a moment, all the fiery eyes were focused on He Hai. On this day, Deputy Director He Hai felt for the first time that he had become the focus of the directors and deans. Outside the operating room and washing area, Director Chen finally completed the training before entering the operating room. He quickly disinfected his hands and entered the operating room impatiently. As soon as he put on the surgical gown and approached the operating room, the scene in front of him made his heart stop. Lin Xie, the top expert he specially invited from Tiandu, was standing next to the operating table, acting as a hemostatic device. On the periphery, there are also directors who can be named in the field of orthopedics. The position of chief surgeon is that of a resident doctor. Expert Lin, you. Director Chen's face suddenly turned pale. He was frightened and wanted to stop him. Lin Xie made a shushing gesture to tell him to be quiet. At the same time, he warned without raising his head, Director Chen, he does a better job than me. Please be quiet first and don't disturb us. Director Chen, don't squeeze me, someone said. The other directors also stayed close to each other, fearing that they would miss the opportunity to observe a world-class operation. Seeing this scene, Director Chen became even more frightened. Did these bastards take advantage of their absence to negotiate that the resident doctor would take the blame if the good person was gone? What the hell? Step aside. Director Chen was extremely anxious, and the authority he had cultivated over a long period of time completely exploded. He Hai, who was the weakest, shivered and moved away. Director Chen quickly came over and took a look. The next moment, the anger on his face slowly dissipated, and the anger was replaced by shock, and he looked at the scene in front of him in amazement. What is this? Smooth operation. Art like cutting, medullary expansion, blood vessel and nerve connection. Even though Director Chen is a layman, he can see that Su Qiu has real skills. Outside, He Hai saw that Director Chen was relieved, and hurried over and said, Director Chen, you think it's okay, how about giving way? He is a layman, don't waste such a good learning opportunity. However, Director Chen didn't even turn his head and said, quiet, don't disturb Dr. Su. He Hai. Time in the operating room passed by minute, 2 hours passed quickly. The operation was also coming to an end. The articular cartilage of the tibio-talar joint surface and the tibiofibular joint surface were removed one after another. Pulse flushing of the medullary cavity, high-viscosity bone cement was injected into the medullary cavity. Installation of bone cement-type intramedullary needle at the marking point, the exquisiteness of the master-level bone reconstruction. Technique is always revealed in every detail. The expressions of the crowd also changed from shock at the beginning to numbness now. They suddenly felt that Su Qiu should be like this. Vancomycin powder was applied around the prosthesis, and the anti-infection measures were in place. This is Dr. Su. A spiral drainage tube was placed in the wound cavity, and the subsequent drainage was considered in advance. This is Dr. Su. At the end of the operation, Su Chiu completed the bone reconstruction, and then sutured the surrounding muscles to cover the prosthesis in turn. Just when he was about to suture the deep fascia and skin to completely end the operation, Lin Xie suddenly interrupted Su Chiu's action, and the next moment, Lin Xie's words made everyone in the operating room's heart rise to their throats.